being senior horse nutrition. You know, we can talk a little bit about what that is. I'd like to pull up a PowerPoint if that's okay, Neely. Is that okay with you? I'll see if I can pull it up.
Yeah, please feel free to share whatever you've got.
Okay.
Scott, I'm going to mute myself because I've got some traffic that comes down my road. But
okay. Can you see that though?
Yep, can see it just fine. And if you'll go to, oh yeah, you can do it that way. That's great.
Okay, I can roll it. Okay. You know, basically, the thing about the senior horses today is we have so many, they get such great care now, you know, compared to say 20 years ago even. The dentistry, the nutrition, but just overall health care for these horses is just phenomenal. So, you know, what we do, we see a lot of senior horses living much longer, much more productive. I can't tell you how many, you know, rodeo horses or just show horses in general that are well into their 20s and still performing extremely well because of a lot of the different, you know, orthopedic things we can help them with, or any of that kind of stuff. So having the, you know, the longevity rolls back to having extremely good care in a lot of different ways. We're going to kind of focus on the nutrition side of it, but you know, you got to think about how you're feeding them. Even as young horses will impact them as older horses. So we'll kind of get into that. But, you know, again, being good health, good nutrition, good vaccinations, good everything early on in their life is going to help them get to those golden years and keep them productive and moving forward. So that's what we like to see is, you know, from a nutritional standpoint, I see such a huge advantage. I remember when I was young, I had an old horse. He was 18. Everybody used to kid me about him being 1 foot in a banana peel and 1 foot in a grave, you know, that kind of thing. And, you know, that was considered very old, you know, 18-year-old horse 30, 40 years ago was old. And, but we've come so far, especially in nutrition. You know, one thing I'm very proud of is, you know, as Purina, they were the first with a senior diet, which was developed by Dr. Les Brewer, and he was a phenomenal equine nutritionist that developed so many cool products. But Equine Senior has to be one of the foundational best products he ever put out there on the market. And when you start, you know, looking at senior feeds, they've certainly come a long ways over the last several decades. So what is a senior horse? You know, I get asked that all the time, Neely, and I'm sure you do as well. Like, you know, how old should my horse be when I start feeding him a senior diet? And there really is no age. You know, your horse will typically tell you. And then, again, a lot of it goes back to how well they were cared for in their early life, and you know how that's all gone along. Their dentistry, things like that will tell you. You know, today, again, we have a lot of 20 plus horses that are on normal diets that still eat good quality forage and they function really good. You know, my bottom line on senior going to say equine senior, and I guess we need to clear up that part too, is what makes like a senior horse feed. To me, the senior horse is the horse with missing or no teeth. That's really your big breaker right there. You know, if they don't have teeth or they're missing teeth and they can't grind and chew forage, that's the big one. There's no other options. The horse must have fiber, forage in his diet, or else things cease to work. So when you think about senior horses, you really want to keep your eye focused on that forage side of it. And you know, a lot of old horses that can't really chew and swallow hay will act like they're eating it. You know, that's what a horse's natural instinct is, to graze. So you're going to see these guys out there grazing, but they'll chew on it and they'll spit it out, and then they'll go get some more, you know. So if you start seeing you know, little quids of grass wadded up and things like that, that's a telltale sign that your horse is really not consuming the forage. And again, you can't get past the fact forage is the most important thing they consume in the day, fiber. So we have to make sure that's taken care of. And when you look at different senior feeds, we have a senior feed designed for horses that can eat hay, and we have a senior feed that's designed for those who cannot. And the ones, I guess that's probably the biggest thing. I tell people all the time that our senior feed, equine senior, has been around for decades. It's probably the most misfed feed we have because typically people don't feed it in the volume they need to. And it all goes back, again, to taking care of that fiber component in their diet. So,
Scott, I'm going to echo some of the things you just said and reiterate how important the fact of the physiology part of what makes a senior horse. And I agree with you wholeheartedly. I start to tell people as soon as you start to see dental changes in horses so they're no longer able to adequately chew, they need to start switching over to something to meet their nutritional requirements. And that, in some horses, depending upon how early in life you start managing their teeth, it may be 15, it may be 30. You just never know.
Right.
I had a horse when I was younger that I had to manage that was in an accident and got a tooth kicked out and actually had to be switched to a senior feed.
Yep.
In life. Then he was 10 and we had to switch him to a senior feed. So really it's not about how long they've been on the planet, but
Correct.
Some of the physiological changes you're going to see in that dentition. And for those of you who are more interested in some of the specifics on the dentition, we did a fantastic meeting just a few weeks ago with Dr. McCauley that explained some of those details in better detail and much more eloquently than I can today. So if you guys have any questions about that, you to go look that one up.
Yeah, they have come so far with the equine dentistry over the last couple of decades. It's amazing, and that I think that's really attributed probably one of the biggest things that's helped. I think, horse owners are more aware, the dentistry part's just better. And we pay attention to that. And then when you add in the nutrition side and just overall management improving, it's a win for the horse. And quite frankly, we see these guys living longer and more productive years. So that's always good. So you always wonder how do you relate stuff to humans, dog years, horse years, things like that. So basically down here on the bottom is your horse's age, and on the side over here is your human age. So your 21-year-old horse is in that 60 human years range. You'll see a lot of, say, brood mares that drop off on reproductive efficiency and things. Some of them will hang in there longer, into their late 20s, but not very many. But it's just very similar to how the humans progress there. So, just so you know, that's kind of how we track according to the human side of things. So, we'll go back to, what do you make of what makes a senior classified horse, and it could be that we've just kind of moved the new 20 is now 15 or whatever, new 15 is now 20, but kind of like in humans, it seems like the older we get or older I get, the younger everybody else is. But, it's whenever they do get to a point, and a lot of this does, it's just not set in stone. There's genetic things, there's management things, there's all kinds of things that have to play in this, but typically around 20, it's not always just their teeth. It could also be their ability to digest nutrients and absorb nutrients like they do. I look at this as no different than humans either. You see a lot of products on the market for humans that are in their, 60 plus years of age, say, that's really directed at better nutrition from an utilization or absorbability, insurers, drinks, things like those that people consume that help them. Same thing with the horses. We got to be kind of really dialing in the nutrition side to the age of the horse and that type of thing. So, when you look at just overall on a senior horse, and I got to put my specs back on here for a minute, but, you can start at the front and move your way back when you think about aging horses. We've talked a lot about dentistry. So making sure that's taken care of. You can see horses' hair coats, kind of deteriorate with age. That could be a simple nutritional need not being met. You can also see respiratory problems, body condition. They just don't maintain their body condition, especially say in the wintertime. In a lot of really cold climates, we're lucky to be in the South. We don't have quite that big of a problem here, but up north, it can really be a problem. So, anemia could be a problem, hoof problems, joints, just overall, there's a lot of things that can, kind of indicate, just like older people, horses' overall body inflammation can increase. So it's a lot of different things going on that, you can, again, like when it comes to, say, joints, I think you got to be realistic with joint supplements, but if you do find a joint supplement that works for your older horse, I'd certainly encourage you to use it. Technically, feed companies cannot add them to their feed because it's just against the laws, but you can certainly add one that you feel that is good and does a good job. So I'd encourage people that, if you find one that works well, use it. What are your thoughts on those, Neely?
Yeah, I think there's some definitely. So as horses age, I have a couple of comments about the physiology, about how they age. We're going to see all these changes in them.
Mm-hmm.
And the main thing that I see primarily, because I've been fortunate or unfortunate in life that I have acquired a herd, per se, of senior horses that I end up managing. They're not necessarily all mine, but so I've learned over the years some tricks. And one of the things is, the first thing you're going to start seeing in these aged horses, especially if they're in a inflammatory state where they have joint disease and things that you're just not managing well, or somebody hit before you and stopped managing, or the horse got old or the kid grew up and they just threw the horse out. The first thing they're going to lose is that top line.
Mm-hmm.
Right? So it's really important for people who are trying to manage aged horses and still extend that longevity or bring a horse back to be a kid's horse or something. It's really important for them to understand a body condition score system and how to utilize that on these horses. When you're using a body condition scoring system on an aged horse, it doesn't necessarily work the same way when you visualize it, right? It's very important to get your hands on these animals because you'll still be able to feel those fat pads in the same. However, senior horses tend to lose muscle along the withers and the top line a lot sooner than you think. So you'll start to up to their rib cage next to their spine start to poke out. That doesn't necessarily mean that they're in poor body condition. It just means that they've lost some musculature and some muscle tone due to the process of aging. So one of the really important things is to maintain that. And, sometimes feed itself is going to be beneficial in helping maintain that top line, but it's not going to be the answer, right? We need to make sure that these horses have adequate exercise, and to keep them moving, we're going to need to have some type of joint support. And my old mare, she's 28 and she has a locking stifle. She also has a chip in her hock. And one of the best things I can do for her is I provide her with a little bit of joint supplements, not regularly, because I don't manage her. She's not being used for anything other than she's retired. She's earned a good life. But she gets a joint supplement, and if she gets really painful, we go to a little bit of Previcox every once in a while. But for the most part, the best thing I can do for her is leave her turned out and allow her to provide herself with adequate exercise and allow her to graze appropriately like a horse is maintained and is meant to do. Forcing exercise on aged horses is kind of, or inflammatory horses is kind of difficult for them and can cause more problems than they can help sometimes. So be really careful with that. But with her, I mean, she's got and she exercises as much as she wants or as little as she wants. And it seems to keep her joints happy. It helps her maintain that top line because she's eating off the ground. And she's able to absorb those nutrients a lot better than if I just kept her up in the stall and left her alone. So,
That's
I mean,
my great point
in managing these senior horses is it's a lot about feed, but it's not just feed. There's a lot of management techniques that go into keeping aged horse happy and sound.
That is probably the biggest thing I run into when I'm consulting with people about their horses is management. You know, you take these older guys and they're almost, you know, if you have a, you know, it's almost like you need a geriatric ward or something, you know, because they just can't defend themselves like they used, or they're not going to be the dominant horse in a lot of cases. Some may be, but they tend to lose that edge with age, you know. And so not only that, but also look at, you know, how they eat and what they're eating compared to the rest of the group. You know, you're going to have to feed them differently. You typically, on these horses that do truly need fiber built into their feeding, their feed itself, you have to feed more of it. Thus, it takes them longer to feed. You know, if they're getting pushed out of their feeder, you're really spinning your wheels. So huge part is managing these guys and putting them in an environment where they can thrive. You know, it's, you know, a lot of things can happen, especially down here, non-sweating, those different things, or, you know, joint issues. So having everybody dialed in on how to keep that horse comfortable. And these older horses, they certainly do benefit from being able to move as much as possible. So having them turned out is a big deal. And I really think that's a great point. Some of the things that's so frustrating to me and what I do is I can't manage them for you. I could tell you what to feed them, but I can't, you know, and not everybody has the ideal situation to, really focus on that. I mean, they may not have the property. So they really have to work on finding the right way to do that. Well, we'll get into this, but we've covered teeth and things like that. And you guys have covered it, Dr. Neely with Dr. Walker with the dentistry you had on before, but so we won't get into any of this kind of stuff. But you know, it just is one thing to be watching. You know, the quitting is one of the telltale signs they need help. You know, tilting their head, choking is another big deal with these horses that can't chew well. And you know, horses are very funny. They are very aware of not to choke. I mean, when something goes past down their throat, that's a one-way trip. They cannot vomit, they can't regurgitate, they can't do anything. So choking is a big deal. I've only seen one in my whole life, and it was very dramatic. I'll never forget it. And it's usually very painful for the horse. So you want to avoid that at all costs. You know, so again, the choking piece is just something that you got to watch. So a lot of these feeds, a lot of senior feeds are designed, you can wet them. Actually, you can wet most any feed out there. But it does help. There's even wetting some of them's hay if you're doing it. If they do have, you know, an ability to chew hay to some degree, but it may help with their hay if it's wet. You'll see horses sometimes if they can, if people don't like it, but they'll go put their hay in the water just to soak it. And it's like they're trying to help that stuff get better. So, you know, having the right setup and having the right system, making sure your horse can eat and make sure everything's good. That way they can grind it if they need to. But wetting feed is a big plus. And we design our senior feed to be soaked if need be. You don't have to, but you can. So, again, there's some of this
before you go any further about the choke, and some of you who've dealt with it before, and the importance of wetting some of those feeds or their hay. You need to be careful if you are feeding a soaked feed. It's not necessarily hay, but if you're feeding a soaked feed product and they're not eating all of it, go in there daily and clean out the remnants, or you're feeding moldy, disgusting, rancid feed products to your horse, and it's going to lead into more digestive upset than into, especially
sure.
Down here in the South, right?
Yes, for sure. Yeah, I encourage people to clean their feeders. Also clean their containers they store feed in. You'd be amazed how many of these, especially now, you know, not just with us, but other companies have these really good high-fat diets that work really good. But, you know, over time, just in, say, your barrel you store that feed in can get rancid. You know, the fat buildup in those barrels gets to be more, and it's really something you don't necessarily see, but your horse's sense of smell is so good and so anything that kind of turns them off on that, I would encourage people to occasionally clean those containers out, feeders out, just soap and water kind of breaks down that fat layer, and it just makes them better, makes them feel better. They're not dealing with all that. So that's very good points. Just overall, you know, when you look at your seniors, you know, keeping them vaccinated, dewormed, farrier, gosh, all these things are so important. The dentistry exams, you know, of course, your feeding program, but it's a whole package. You know, there's not just one thing. You leave one of those things out, you might get away with not doing blood work every year, but overall, you need to make sure your dentistry, your feeding, your vaccines, and everything else is in place to have your good, healthy, productive senior horse, you know, or happy senior horse, whatever you may need to be. So those are just some things that, there may be some things you would add to that, Dr. Walker. Those are just something I'd come up with.
Sorry, trying to get back to unmute. Yeah, I think, you know, something that Scott and I were talking about on this meeting, you know, it's important to kind of have those markers done as your horse to see changes in your horse, right? Like on my retired horses, I don't do blood work every year, but when we do start to see big changes occurring, I will get some blood work done just to make sure that everything's up and up, because you'll start to see some changes in senior horses. Some will get PPID or Cushing's, right? Some will get some metabolic disorders that it's going to change the way that you manage them overall, but it's also going to be important to know because it's going to affect the way that you're going to feed them. You know, aged horses don't always look poor. Sometimes aged horses can be over fat. They could be over and that leads to another an endocrine response that we have to manage more effectively, so we don't use with their feet. So it's not necessarily always, you know, we think of aged horses as the skin drooping off of them, they're losing muscle tone, they're kind of skinny, they're kind of hard keepers. That's not necessarily always the case. And, you know, each horse has something different going on with it. So having a wellness program in place and having a relationship with a veterinarian is definitely always going to be important to keeping these horses around and increasing their longevity. And especially if you're going to keep these horses working in a show pen or even as a lesson horse, is really going to be important to kind of keep them on the moving and being an essential part of your program.
Yeah, you're absolutely right. We've probably kind of directed this conversation more towards the thinner, you know, going away, kind of like this next horse, this picture here on the left. But they're not always like that. So you're right. They can be overweight, and overweight's as bad as underweight. So there's really, you want to keep them in that body condition score, 5.5, 6, you know, kind of depending on their breed and kind of what fits for them. But definitely overweight can lead to some serious complications as well. So it's a lot about managing body condition, no different than the rest of the herd or horses you would keep. But, you know, being aware of, you know, the fat pads building up and things like that. Just little things that can really, you know, change how you want to maybe certainly working with your veterinarian. There's, you know, the Cushing's thing is certainly advanced a lot with, you know, better technology, better things you can do for them. And, you know, part of that is certainly their diet, you know, keeping their diet in check.
And just to prove that point, there was at a conference, a research conference I went to a few years ago, one of the research papers that was presented there indicated that almost 80% of senior horses that were used for step for other reasons, 80% of these horses came in, they had pituitary lesions, which would lead to the fact suggesting that one of the causes of these horses declining was the fact that they had Cushing's or PPID situation.
Yes.
So, you know, they suggested that Cushing's is more of an aged horse concern. It's going to manage them overall.
Yes. I totally agree with all that. That's absolutely true. I guess the one thing I would say too, if you are comfortable with a product, a feed you're feeding, but your horse is not chewing and grinding their hay, the only thing I could throw out there is that there are a lot of good hay cubes, hay pellets, different things like that you can utilize on the forage component. Just remember that, your average 1,000-pound horse, they need 1.2% of their body weight minimum in fiber. So that's 12 pounds for a 1,000-pound horse of some type of fiber, whether it's a pellet, cube, flake of hay, whatever that may be. That's the part we're trying to really focus on in a lot of these different senior horse diets. So making sure they have that part of their nutritional piece met is going to keep your horse moving forward and healthy and happier is the main thing. So again, not every senior horse, I mean, when they hit 20 years of age, they're doing great on a lot of different nutritional supplements. So, carry on with what you're doing that works. And I would say that just be on the lookout for all these little telltale signs that are telling you, or potentially telling you, that you may need to think about helping them get the fiber component met. One of the things I see in the countryside is that there's some senior feeds out there that are not complete, meaning the hay is not in there. They kind of worry me, because I think everybody assumes a senior horse feed would have that, and some of them are not. And then you see some of them that are extremely high in fat, and that appeals to people. But if you're feeding a complete feed, at the rate that you need to make sure their fiber components met, and you're feeding that much fat, it can also be a problem. I mean, they just get overweight really quickly. So
right. I think it's important too to remind people that, as you go through the physiology of nutrition, horses are only, their stomachs and their digestive tract is only built to absorb 20% of their daily fat, or their daily nutrients can be fat. And that's everything else just goes right on through them. So if you're feeding percent of their diet and fat, you're wasting your money.
Yes.
Also, people always think too, oh, my horse is getting aged, I need to throw fat at him. That's everything. Even when I was in school, that's what they taught us. Your horse is aging, it needs more fat. And I've learned on the contrary. I think nutrition has progressed. And thank God for that, because I would throw so much fat, all the additional oil supplements, high fat diets, and spending a ton of money, because it seems like fat in a complete feed seems to jack the price up so much faster than anything else.
Yeah,
but
that's true.
In reality, some of the research that we've seen, it indicates that a lot of senior horses are actually protein deficient.
Exactly right.
How simple is this that, I have 2 senior horses that I'm managing right now, and really all they needed was an increase in their protein. And how did I do that? They're fine, got good teeth, everything else is in good condition, no other concerns. So they get extra alfalfa in their daily ration. That's it.
Yep,
it's a simple, cheap addition of alfalfa, and they're happy, healthy, fat, and shiny. So it doesn't always need to be expensive fat, or some of the, like you said, some of the countryside, or even knock on some of these very expensive, very well-researched fat supplements that tout some great claims. It may work for some horses, but it's not necessarily the I want to jump to.
Right. Yeah, you see that. You always wonder, I don't care what percentage the fat is in the feed or the diet or whatever, that, you got to wonder about the 90 other percent of what's in there too. And you hit on it earlier in this conversation about, top lines on these older horses are typically the first place you'll see some things going away, which comes right back to protein. That's not a fat issue. Typically that's muscle. All up on their back is muscle. And the first place a horse, just because that's the way God made them, was if they're going to lose muscle, it's going to be up there. It's not going to be in their legs. So that helps them flee a predator or something like that. So that's where it's going to show up first. And that's where the last place you're going to put muscle on one too, is on the top line. So having good quality protein is a real key. Like you said, with your alfalfa, or the feeds, these true senior feeds have, higher lysine levels than, say, an average mature horse diet would necessarily have. And the protein levels are going to be typically in that 14%, which helps you get the overall protein up, especially if you're feeding a straight grass hay diet. So the other couple of things I just wanted to really quickly mention was, vitamin C and B vitamins can be a problem because of, the liver. Again, older horses, everything kind of slows down, functionality, but the efficiency of it isn't as good. So they may need some added vitamin C and B vitamins in their diet. Just something to be aware of. It's hard to really tell that, but when you look at our senior feeds, they're going to be fortified, especially in these types of things to help them get there.
Right. We just had, to reiterate, you just covered it, but we just had two people comment, Rich and Katie both mentioned that it's really important that we're also maintaining some mineral supplement or just general whole horse supplement to maintain their overall minerals and vitamins, especially if we're feeding a hay product, especially through the winter months. That loses, horses can only get their vitamin E through those leafy greens. And if we're feeding a hay supplement, or if we're feeding a stored hay, it may not necessarily have all of the nutrients that the horse may need through the winter. And especially in Louisiana, we do struggle with some of our, we have a lot of water content in our forages that grow naturally. So they may not always have all of the mineral vitamins that our horses need to help them maintain. So Katie had a good point of making sure that we get tested or test our forages just to make sure we're meeting the minimum requirements. And then Rich also mentioned that, we need to make sure we're also making sure that those vitamins and minerals are being met with some type of supplement throughout their diet throughout the year. So
yes, yeah, very critical, especially with, like you said, with those straight forage or high forage diets. That's the one thing. Your forage is always a wild card in your forage program. We do a lot of forage analysis for people just because we've got to make sure what that part is contributing to their overall diet. So knowing that is very, very helpful. Certainly tell people all the time, the better your forage, the less concentrate or anything else you need to add to their diet. I mean, when you think about what is our feed designed to do, it's really just designed to fill that gap between what the horse forage provides and what their requirements are. And that can depend on what type of forage they're on, and also depends on how much activity or work the horse is doing throughout the day. So, some of them don't have a very wide gap, and some of them have a huge gap, and typically those horses that have huge gaps can't graze all day either. So you have to supplement that somewhere or another. Again, body condition, big thing. That's something that's simple that you can tell. If you call Dr. Walker and say, hey, my horse is struggling, and if you could tell her a body condition score or tell me a body condition, that gives me a real good visual of, I don't know what that number means, and I can kind of, roll that into what that horse really truly looks like. If you just tell me he's underweight, that doesn't tell me a lot, because I don't know what he should weigh necessarily. So having a good idea of what the body condition score from a 1 to a 9 would be really, really helpful. So these are just pictures of different horses that, we have worked with over the years. And that's one of the cool things about what I do is somebody who really is off in the ditch with the nutrition side. If you can get them straightened out, these horses do respond well and come back and do really, really well. So I just had a customer we worked with that he was 39, would have been 40 next year, but she lost him, but he had a good life, she had him all his life. And it was quite a story, but he was one of those ones that really needed some help and nutritionally, and she followed everything, and she got that guy back to really doing well, and gave him honestly another 10 years of longevity that he may not have had. And so it comes back to just taking care of these guys. And I would tell you too, watch what your senior feeds. Here's our equine senior. That's the complete feed. And we have the active senior, which is designed for the older guys that can eat hay. And so they're two different. They're, this one if your horse doesn't eat any hay at all, you can feed this. you know, you're going to be feeding maybe 15 pounds a day total. So you may want to break that up into two, especially 2 feedings, but maybe 3 feedings. But that way he gets the fiber component of the diet taken care of. So that's the big thing. You know, with your other feeds, like your normal concentrate, you're looking at, you know, you can feed the hay with it. You're only looking at feeding, you know, 4 or 5 pounds a day of this type of feed to a lot of horses. So there are some things in the senior feeds. We have a prebiotic in our senior that is really designed for inflammation and for immune systems. You know, that's where we worked with the University of Kentucky when we were developing that product that's called Active Age, is what we call it, prebiotic that is helpful in getting the immune titers better, where the horses actually, when they are vaccinated, that vaccine takes better, works better. And then overall inflammation, you know, as we all get older, we typically see we get a little puffier, and a lot of it's just inflammation. And so there's some benefits of that too. So anyway, just the having those kind of things in these types of feeds are helpful. And we're working on stuff all the time. If we do find something that will benefit them, we're, you know, eventually going to make some changes. Anyway, I just didn't want to give you a big old commercial there, but I just, you know, like to kind of tell you why things are different. And one thing you did mention, you have maybe one that's easy keeper, you know, that he can eat hay and he's happy out there doing what he's doing. This Enrich Plus is a really cool product for easy keepers of any kind, senior, young, doesn't matter. It's a super concentrate where you feed a pound and a half a day. And it's you know, a protein, vitamin, and mineral concentrate, because they still need protein or supplement. They need vitamin and mineral, even if they don't need the calories. So this is a really cool little deal. You can add 1 time a day to their diet and to your forage, and they thrive on it. So it's and keep that top line from going away and things like that, where they're not going to maybe get it from their pasture forage. This will help keep it in there. So good little stuff. So if anybody had any more questions, we'd be glad to answer them.
This would be a great time. I know we kind of covered a myriad of things and just briefly mentioned some of the metabolic and some of the endocrine issues. But if anybody has any specific questions on things that we need to be aware of for actually feeding the senior horse, now would be a great time to shoot those over. I can watch anybody on Zoom, trying to get to everybody here on the Facebook Live. I think Katie also mentioned that, you know, getting before that, getting your hay or your grass tested is great. But there's mineral hair analysis available for those people that have some really tricky situations where feed in general just isn't working. You know, my comments on feeding horses really is, and Scott mentioned this earlier, if you do a good job throughout the horse's life of not overfeeding and not underfeeding as they age, if you make all the things that you need to help.
I think you froze up there. Hey, Neely. Well, looks like we may have lost her, or we may have lost everybody. I'm not sure. Let's see if we can get her back. Maybe she'll pop back up here and we can do that. But if you do have any questions, we can always answer them after the fact, after this goes off. It'll be up, I'm sure, again online, and you can ask questions there as well. You don't have to ask them exactly right now, but if you do have anything, we would certainly be willing to help you with. It's always interesting to hear what people are dealing with, and sometimes this stuff gets to be pretty tricky. We're back.
I think I got kicked off.
They might have.
Okay, let's see if we're still live on Facebook. Good. Okay, so I think some of the things that we do with horses can be that we do to them while they're young really affects the way they're going to be maintained as they age. One of the research deals that we talked about when we were talking about some of the metabolic disorders, the way we feed our horses, and especially in some of the industries, they like to overfeed young horses. And that honestly could put them in a really bad situation metabolically and endocrinology wise as they age. And that gets them into that more overfed, overconditioned, insulin resistant situation. And it makes them more prone to be easy keepers. And, as an industry, we like easy keepers. We like those fat, sassy, shiny horses. But none of us like the idea of soaking feed, of having laminitic horses, of having to make corrective shoeing or we want the easy horse, but we don't want the easy keeper that comes with all of the negative connotations. So it really we do need to start increasing feed in these young horses, but we need to be mindful that it needs to match their nutritional requirements, the activity that we're using them for. Yes, growing is one of the most energetically costly events that a horse will go through, and they're growing and we're training, so we're adding a lot of exercising and remodeling and bone growth and muscle growth. So it is important to support them, but it's not as important to make sure that they're fat and sassy and shiny as an 18-month-old.
Correct.
So, and the same thing goes for a senior horse. You really need to be aware of the conditions that these senior horses come to you with. If you have a horse that is stifled, or that has some laminitic problems, or some feet issues, or some joint issues, we really don't want them to be over-conditioned, because it's harder for them to carry that weight around. So honestly, as I've gone through some of this and managed some older horses, I'm almost a bigger fan of keeping a horse kind of at that 5, maybe 5.5, and almost reaching for that 5 sometimes, especially in the summer months. With my old mare, if she's a 4.5, almost 5, she really feels good and can move around fairly effectively. As we go into winter, I'll feed her a little bit heavier and try to get her a little bit more conditioned, but it's really hard to get these horses as a whole picture to stay healthy. So it's not just let's get our horse fat and leave them fat. It's let's look at what this individual needs and make sure that they have something tailored to them. Senior care can be daunting if you've never done it before, but as you kind of get into it, it's really kind of fun to see the progress that you can make with them and how you can maintain them. And the feed industry and the nutrition side of things have really developed, and honestly, Purina does a great job of the research aspect and publishing the research, and that's kind of why I invited Scott today. There's a lot of companies that have a lot of really great products, but
they are. Yes.
One thing that I'll say is you really need to go and do your research and make sure that the company that you're buying your products from does their research as well. One of the things that I see a lot of as an extension specialist is people will buy their feed or make their own feeds from a co-op. And sometimes that's great, especially to keep costs down if you're managing a large farm and you're feeding a lot of your own horses. However, you need to be very careful when you are buying feed from a co-op that mixes feed for all species. There are a lot of additives that can get added into cattle feed, into swine feed, into poultry feed that are deadly to horses, okay? And if the feed mill that you're using doesn't have bins and mixers specifically for horses, you need to do your due diligence and make sure that they're cleaning those things out adequately, so you're not introducing a situation to your horses where inadvertently you're going to cause them harm. And honestly, in my standpoint, from my experience, it's really not that cost effective to have to do all that research anyways. It's just as easy to go to the feed store and buy a complete feed that has all of your minerals, all the rations done by smart people who do this for a living, who've done the research. It's really more cost effective and a lot less headache to just go with a complete feed from a reputable company to begin with.
We see that a lot too, and I echo your concern about what else do they make there. We make all of our horse feeds in ionophore free, so those are the primary things out there that are drugs that are in cattle stuff, and it works great in cattle. But like, you know, we have a feed mill in Shreveport, Louisiana. We have one in Arcola. We make horse feed in both. We don't make any of those other kind of feeds products in those facilities. We have feed mills in Lubbock, Texas, and Gonzales, Texas, that we don't make horse feed in. So Fort Worth makes horse feed. So we try, our horse feed lines are totally separate.
Right, and that's for safety's sake. I mean, if you guys have done any amount of research on any of these feed companies, it's not difficult to do a quick feed company search and find that some of them have gotten into some trouble before. And they're reputable feed companies.
Oh, they're very good companies, yeah.
And they have fantastic products and fantastic research. But for me, it's not worth the risk of having to go through that and losing such a huge investment, especially if it's still a performance horse, to go through that, honestly. But let me check one more time and see if anybody else has any more comments or questions. Looks like everybody's just agreeing with what we're saying. Man, Scott, we did a great job today.
No. I did say when you had left me, I told him that, look, if there's any questions later on, you know, fire away. I'm sure you'll be watching the page and I can see it. And, you know, if they got questions later on, they can always ask them.
Right. And if you don't have an opportunity to join us today during the broadcast, this will be shared back again on Facebook, and then I'll post this on our YouTube page. So we'll have this indefinitely. For those of you who are watching this later and if you have any specific questions that we didn't cover, please feel free to email me. If I can't answer them, I'll make sure I get them to Scott so Scott can answer them. If you have any specific feed product questions, Scott's definitely up to date and can help you answer those things. And I know, doesn't Purina still do farm calls where they can help you formulate a farm plan?
That's a lot of my job. And there's others out there too that, you know, if you ever need any consulting or anything at the farm, I personally, that's where I love to be, because it's always helpful for me to see the situation, see the management side of it, see the whole picture, not just the feed picture, because there's usually, like we said earlier, other components could be in there, very big factors. So forages, you know, we do forage analysis, providing you have, you know, we really truly need a fair amount of stocked hay before you really do that, because if you're buying hay every week from your feed store, it really isn't very effective to do a forage analysis unless it's always coming from the same place, which you don't always know that. So, but no, we love to do on-farm consults, and we work with some of the best farms in Louisiana today, and we certainly look forward to helping anybody we can.
Hold on, Scott, looks like we have a question. I'm just trying to access it. My internet's not helping me. Katie, if you're listening and you said Marcella had a question, I can't find the question that she posted. Can y'all repost that? Let me see if I can get this to play. Trying to find it. Well, let me look one more time. How many pounds should we be feeding a 28-year-old horse on pasture?
Okay, that's a good question, but there's other questions you got to have, or I have to ask you. Yeah. You know, are they consuming the fiber? Is that 28-year-old horse chewing, grinding, swallowing the hay? You know, if they are eating the grass when on pasture, they're out 24/7. You know, maybe enrich plus 1.5 pounds of supplement will work. Or
so
maybe
let's go. I'm going to guesstimate that this is going to be a horse that needs to be primarily on a senior feed that's not going to maintain body weight by eating pasture.
okay.
Because that's the most common thing that we struggle with, right?
Right,
Everybody misfeeds Purina Senior.
Yes, they do. And I wish I knew more information, like exactly, is a horse a 1,000-pound horse or not? And body condition would be good to know. But typically, say it's a 1,000-pound horse, he's in a body condition 4.5, 5, so he's about right where it needs to be, being around a 5. You're probably looking at around 10 pounds of equine senior and a day, and probably in that 4 to 4.5 pounds of active senior per day. Oh. So if they didn't need a complete, we have the active. If we need a complete to really make sure that fiber component's being taken care of, then you need to feed at least probably in that 10 pounds a day range of the equine senior.
So Scott, if this is, let's say that this is all that this horse is eating. It's on pasture 24/7, but we're not aware of its ability to eat anything. A 1,000-pound horse, if they're eating, or if they're on pasture but not able to get the nutrients out of it, how much senior should they be eating? I'd
say between 12 to 15 pounds a day.
Yeah.
That way you're getting that 1.2% of their body weight in fiber, So, and you can go up on that. I mean, a horse on pasture or has, 24/7 access to good hay, they're going to consume maybe 2% of their body weight a day in fiber. So, providing they may be out there, like you say, chewing around, playing around, acting like they're eating it because that's what they like to do, but not really doing it. They could be spitting it out and not swallowing it. So it's really not doing them a whole lot of good. So in that case, you're going to be in that 12 to 15 pounds a day range. And it's always good to weigh it up occasionally, take a scoop or whatever scoop it is and put it in a sack and take it at the grocery store and throw it up on that produce scale or something, just see what it says.
So this is something that I harp on big time in 4-H, okay? So you're supposed to feed by weight. Not by volume, okay? Right. And what do I mean by volume is everybody is notorious. You feed the yellow scoop from Tractor Supply or the big metal scoop from Tractor Supply. You may feed a coffee can. You may have a Mardi Gras cup you feed. Okay, those are all different volumes, okay? And your senior feed is a different surface area than your alfalfa pellet. So if you weigh your alfalfa pellets and you know what 7 pounds of alfalfa pellets are, that is not the same of 7 pounds of senior feed because they're all different sizes, all different ratios. So you actually have to take the feed that you're going to feed, weigh it, and you can mark on your line, you take your scoop and mark 7 pounds or whatever it is on your scoop. So this is 1 full scoop is 2 pounds of senior. 1 full scoop is 3 pounds of alfalfa pellets. You don't have to do it every day, but you do it enough until you know. And you don't have to take it to the grocery store. You can, but you can take a luggage scale. They have those little portable ones, a fish scale, baby scales, whatever you've got available, just to kind of give yourself an idea. Make sure if you're going to use your bucket that you put your bucket on first and make sure you know how much your bucket weighs before you put the feed in the bucket or in your sack or whatever you're using. But it's really important to make sure that you're feeding by weight and not by volume. Really, if you go and tell your veterinarian, you tell Scott, you tell me, I'm feeding my horse 3 scoops of alfalfa pellets, that tells me nothing, okay? I don't know what your scoop is. I don't know if it's a gallon milk jug. I don't know if it's a coffee can. I've seen everything under the sun as far as what a scoop actually is on people's places. So if you want to be able to adequately describe what you're feeding to people and give your horse the proper nutrients, the back of your bag is written in pounds. It's not written in number of scoops. So you're not going to know if you're giving them all the nutrients they need unless you know how much you're actually feeding them in pounds.
Very good point.
Yeah, Katie just said she has to explain the weight thing to people all the time. Yeah, it's a struggle.
I always tell people if always, back on my day, if they quit making coffee, they were all going to starve to death because we didn't have any coffee cans to feed them with. But, you know,
Yeah.
that just, it doesn't matter what you're using. Like you said, it could be a Mardi Gras cup. It doesn't matter. Just as long as it's, you know what that weighs. I had one lady I'll never forget, just kind of freaked me out because she just got a miniature pony, and she wanted to know what to feed him and this and that. And I said, well, how much are you feeding him now? And she said, 2 cans. In my mind, automatically went to a 3-pound coffee can, you know. And I go, oh my gosh, you're going to kill this little rascal. And no, it was a corn can. So, I mean, it's all in where your head is and what your perspective is. You know, mine was the 3-pound coffee can and hers was a corn can. So,
Yeah.
you know, it made sense. I said, but it doesn't matter. Just weigh that up, and it's probably pretty close to what you should have been getting. But it's just funny how different people think different things, you know.
Right.
Different.
Well, I'll just reiterate this one last time. Managing a senior horse is not difficult. You just kind of have to get your head wrapped around the physiology and how each animal is kind of individual, and everybody's situation is individual, and you need to make a few allowances for that. There is plenty of help available for any of you who have questions or concerns, or you're trying something and it's not working. You know, Purina has a lot of great feeds, but there's also a lot of other great companies that have great supplements, great feeds available. And if you need any help doing any of that research, please feel free to contact me. My email address is nwalker@agcenter.lsu.edu. I'm more than happy to help you. And there's 1,000,001 knowledgeable people in this field that are more than happy and actually enjoy explaining feed rations and helping you plan and manage all of the different horses on your farm. So don't be afraid to ask. And for those of you who didn't get to participate live, just send me those questions. And if I can't answer them, I'll make sure that Scott can help us out, and we'll get you on the right track. And I will say one more thing for you guys who are really, really, really interested in knowing exactly what goes into your horses and really want to get a handle on some of those more difficult horses to manage and difficult cases. You can absolutely 100% get everything you're feeding analyzed. You can get your horse analyzed for mineral and vitamin content. You can get your hay and your pasture analyzed, even if you're buying hay and you're not producing your own hay. There are companies, the LSU Ag Center used to do feed analysis, but we've stopped doing that due to the costs and to maintain that lab. But we do have a reputable lab that we can help you get in contact with and help you send off those samples so you can actually get a handle on exactly what's going into your horses. Some people that I've worked with are managing horses with genetic conditions, and they have to have a handle of down to the parts per million number of grams that we're feeding in potassium and calcium and things like that. So there is detailed analytical help available if you need to go to that level. For this conversation, I thought that was a little over the top. So if you need any of that specific help, just let me know. Scott, do you have anything else you'd like to add?
No, ma'am. But if they ever had any questions from me, they can contact you, and I'm sure you can get with me, and we'll certainly try to help them any way we can. We love doing that. So thank you for having me today, and appreciate you inviting me.
For joining us. Like I said before, I know a little bit about nutrition only by default. This was not my favorite class in college. That's why I went the physiology route. So I'm very grateful to have you as an expert today. And thank you for sharing your products and your experience. Thank you, everybody, for joining us. And we'll see you next time.
Thank you.
Thanks.